INCommunities. And the reason I'm here today is to talk to you about one of the programs that we offer, which is the 211 program. So I'm just going to start sharing my screen.
Terry, I missed the organization. Oh, it's the INCommunities. Is that the okay?
INCommunities, yeah. Okay. So I'm assuming that means you can see my screen now.
Yeah.
Okay. So what I'm going to talk to you about today is something called navigating the system, and I'm very comfortable with questions as they happen and whenever you have them. So please just chime in with any question whenever you have it. I'm quite comfortable with that. So the reason that we're here today, or what we're going to talk about, is that there are lots of programs and services out there in all of our communities across Ontario, and they're funded or they're developed to help people with all kinds of different needs. In Ontario, I think we have something like 66,000 different programs and services in our database. But the challenge is many people aren't aware that these services exist, or if they do know, even sort of in general terms, that there might be something like that, it can be hard to keep up with how to locate those. Programs change frequently. Sometimes two different programs might merge under one new name. One program might disappear. Another one will come up that's very similar, but with a different name. And it's just a constantly changing sort of landscape of what's going on in the social service and human service kind of field. So for any individual, unless this is your job, then it's really hard to keep up with it. So I'm talking to you today from the perspective of you all have enough things to keep track of in your own day-to-day lives for whatever your purposes are. So I just want to show you how you can let 211 help you find the services that you might need as you need them. So INCommunities is the organization I work for. We are a nonprofit that is in our 47th year of as a community information center. But the program that I'm going to be talking to you about is 211. So you'll notice sort of a branding change there. This is a provincial program that we are one of the service providers for. So I'm going to talk to you about the 211 services in Ontario, sort of a background and overview of what we do. And again, please feel free to ask questions anytime you have them. So this is a map of Ontario, and just wanted to let you know how the 211 phone service is set up, or actually the service delivery network. There are 6 different what we call regional service partners. So INCommunities in Niagara, where if you follow that blue arrow down, we are located in Niagara. We are the service provider for Central South Ontario. So that means that calls that when individuals dial 211 from either the region of Niagara, Hamilton, Halton, Waterloo, Guelph, Wellington, Alderman, Norfolk, or Brant, any of those calls will come through to our team. Okay, there is the large blue section there is serviced out of our Thunder Bay office, 211 North. The left-hand corner of Ontario is what we call Southwest. It's served out of the city of Windsor. This blue area is our Central South out of St. Catharines. The central area of Ontario, 211 Central, is serviced out of our Toronto office. The far right is our Eastern office, service out of Ottawa, and all the staff in that office are bilingual. And then this green area is what we call Central East, and that is served out of our Collingwood office. So in our service providing system, we have 6 different providers, but we are all on the same phone system. So one of the perks of that is, and it's happened before, if we had a power outage in our office, it doesn't mean that no one in that whole Central South Ontario sector of Ontario doesn't get service until we have power back. It means that the calls can transfer to the agents in the other areas of Ontario. So what is 211? Can I just ask for, I know not everyone's on video, but if you could unmute, has anyone dialed 211 before? Has anyone ever contacted 211?
No.
No.
Nope. Okay.
311. To be honest, I didn't know it existed until a few weeks ago.
Fair enough. And
I did 311.
Okay, and I didn't see who that was that said that. Geraldine?
Yes, yes.
Okay, and Geraldine, what area of the world were you living in when you dialed 311?
Oh, no. It wasn't me who
Oh, sorry.
dialed 311. That was someone else.
Okay,
That was me. I dialed 311, and it was in Halton region.
Halton,
Oh.
excellent. Okay.
Yeah.
Oh, Karen, hi, I know your name. There you go. Yes, so some areas of the world do have a 311 service, and I'll just kind of explain that in just a moment. So what is 211? I'll start with that. And none of you have called it before, so I'll start right from the very beginning. When a long time ago in a land far, far away, individuals, United Way of Canada, and went to the CRTC to ask for the phone number 211, the 3-digit number 211, to be allocated for information and referral. And that was quite a number of years ago. And the response was kind of, well, you know, there's the internet out there now. Why on earth would we need to have a phone number for people to call and find out about programs and services? There's so much information out there. And that was basically the response back was, there's so much information out there, people don't know how to navigate the system. The internet allows for anyone to post anything up there. It's not vetted by anyone. So it can be a confusing place to go to find your answers, because you don't know if you're getting a trusted source. You don't know if the information that you're getting is correct. And there are still a lot of individuals who aren't comfortable with the internet. They maybe don't have access to it, even, again, depending on where you might be living. It might be difficult to get access to it. They may not have the actual tools to access the internet. During COVID, it's been a huge problem because people who used to go to public access sites to use computers weren't able to. So there was an isolation from information. But the concept of 211 is a single, easy to remember 3-digit phone number that you can call anytime to find out what kinds of programs and services might be available to meet your needs. When I say programs and services, I mean things from what we call the human service sector. And that would be things like government programs and services, offerings from nonprofit organizations. It could be grassroots types of organizations or programs offered through churches, for example. It's that sort of thing. So the idea was that you just have one easy to remember number that you can call to access any of the information on all the programs and services in Ontario. One of the features of 211 is it's also a free call. So unlike 911, if you dial 911, there can be a very expensive call. Sorry, not 911, my apologies. 411. So if you're calling for directory assistance, the charges can be anywhere from $3 to $6 per call. But 211 has no charges for that call.
Terry,
Yep.
excuse me.
Absolutely.
How long ago was 211 established?
It was established, the first pilot was done in 2005. And then in 2000, our office was actually the second to come on, and we came on in 2007. And
so it's been around for quite a while.
It's been around for quite a while.
I consider myself fairly educated and aware of things. I certainly read the newspaper. Why have I never heard of this? How is it advertised?
Well, it's a great question, Geraldine. It's I'm going to answer in sort of a long version. When we start out with a new program like this, it wasn't available in all of Ontario. It started out with a pilot in the Toronto area first. And then, as I mentioned, we were the second to come on, and we were only serving the Niagara area. So there wasn't any provincial advertisement. We were doing it sort of locally at the grassroots to sort of build up the programming. By the end of 2011, it was available to all of Ontario, but we were still a very new type of program and infrastructure. So there was limited advertisement. So that as we were building our infrastructure, we didn't want to have everyone call and blow us up sort of thing. So it was a kind of a slow build. Then we ran into the reality that how we're going to advertise it. the funny thing about 211 is I've been with our organization for going on 11 years now, and I've done thousands and thousands and thousands of presentations like this. Sometimes I will go and speak in front of the same group a year or 2 years later. And what we often hear people say is, oh, I forgot about that. I heard about that a while back and I forgot all about it. What happens is we talk to people about it. They think it's really kind of interesting, but then unless they have a need to call in the next day or two, it entirely disappears from their memory banks. The cost of provincial advertising in print or radio is really expensive for a nonprofit kind of organization. We have done blitzes periodically, but we find that it doesn't really give us any real results. The number one way people hear about this is through word of mouth, through friends or family. Sometimes it's through these presentations. But that's kind of what our marketing analyzing has told us, is that it's word of mouth.
Why not just post flyers in family doctors' offices?
We do that across all of
my family
Ontario.
doctor is at the McMaster Family Practice, and on staff there's an advocate, a social worker you can go to if you need help with anything. And I did meet with him once many years ago. He didn't tell me about this.
And that's the thing, we have to reach out to every one of those doctors' offices. Some of them say yes. We do have those RAC cards that we put in doctors' offices, but they have to agree to do it. And some of them haven't heard about it. It's hard for us to reach out to every doctor across the province. We have done marketing at the provincial level through the medical association. It's just a hard thing for us to get the saturation of the information around, but I will talk a little bit more at the end, Geraldine, about how you can help us with that if you'd like.
Okay.
All righty. So what is 211? It's a free single point of access. There are different ways that you can access 211. The first one is to dial the phone number 211, and it really is as simple as those three numbers. It's not an extension to a 10-digit number. It's just 211. There's also a provincial website, 211ontario.ca, and we have through COVID, one of the perks of COVID was we did get funding to bring 211 across all of Canada, and that only happened towards the early part of 2021. So again, that's Karen.
Oh, you're good. You saw me. Finish what you're saying, and then if you could talk about cell phones, because if I'm on my cell phone, but it's Toronto, but I'm up in Thunder Bay, what happens?
Okay. So the website, we now have 211 Canada, so you can go on 211.ca and find out how to contact whatever part of Canada you're looking to support. We have databases, and I'll talk a little bit about where we get our data from and how we maintain our data. We can also people can access it through live chat online, and they can send emails in to us through it. The email address is gethelp@211ontario.ca. So there's a number of different ways people can access 211. Now, what Karen is talking about is, I'm just going to back up to this picture. So remember I said that there's 6 contact centers around Ontario. And depending, Karen, I know you were involved with this process in the earlier days too. At one point in time, it was your actual cell phone number, or the landline number pointed to your current, your local service provider. But with cell phones, I can have a St. Catharines phone number, but if I'm in Sault Ste. Marie, it's going to actually go to the contact center that I'm closer to. So if I dialed 211 from Sault Ste. Marie with my cell phone, it would actually go to the Thunder Bay office. If I'm traveling in my car throughout Niagara and I get close to the Toronto area, then I might end up getting through to the Toronto office, for example. Does that answer your question or get the points out that you wanted to, Karen?
Yeah, that's exactly what I wanted to know. And then you said earlier, they're all connected on the same phone database. So I'm in Thunder Bay, but I'm thinking about my mom needs something. We live in Hamilton. They can look it up.
Absolutely.
Okay.
I'm glad you're here today. So just to build on that, just because I live in St. Catharines and I call 211 and get the Niagara number doesn't mean that the information I'm looking for is Niagara based. My mother, I use Sault Ste. Marie as an example on purpose. My mother lives in Sault Ste. Marie and she is getting a bit older, and I have had contacted 211 a couple of times for information about my mother and what services might be available to her up in Sault Ste. Marie. The absolute perk and benefit of 211 being a provincial system versus what we were doing as a local community information center serving only the Niagara region is we have the power of the whole system. So our phone system will, we can all support each other. If the call volume is really, really high in one office, then the overflow calls, instead of waiting in line, will go to one of the available agents in another area. And the reason we're able to do that is because we have a provincial database. So we all work from the same database, all of the data records, we search the same way. So it really should make no difference whatsoever where the person who takes your call is situated in Ontario. We're all using the same database of information. So you can call from where you live for information in other parts of the province. You can call when you're on vacation. An example I use all the time, you're on vacation and somebody has a minor injury. You don't know where the urgent care or the walk-in clinics are in that area. That's not your home area. So calling 211 can help give you direction on where you can go to access support at that point in time. So 211 equals easy. It's meant to be, as I said, 24 hours a day, anyone can get information for anywhere in Ontario. So some of the key features, the word targeted there, I don't have a better way of explaining it except that to say every single interaction that we have through 211 is targeted to the caller's needs. So when a person calls into 211, they can expect a similar greeting from everyone. For example, good morning, Terri speaking, 211 Terri speaking, how can I help you this morning? Something along those lines. The closing is also a common approach, meaning I'd review what we talked about, what referrals you've been given, ensure that you're clear on what your next steps were. I'd invite you to call again and thank you for calling. But the part in the middle is really driven by the caller. So whatever the person is calling about and whatever their current focus is, that's how the call is targeted to that. So if a person calls in and says, I just need to know what time the library is open to. Well, that's not a good example right now. What time the food bank closes, for example, today. That's just an information only. We'd look that information up and provide that. We have people who call us and say, I need to act, I'm having challenges making ends meet this month. I'm running low on food. I don't really have any money left. I'm not sure what options there are. Then we kind of talk about your situation. We'd find out where you live. We get the information and assess what your needs are. We'd clarify that back with you so that we make sure that we understand it correctly. You would confirm, yep, that's exactly what I'm looking for, or no, I don't know where you get that from. This is what I'm really looking for. And once we're on the same page, then we would search our database and give you the appropriate referrals for that. A lot of times people call us in more of an abstract way. So when I say 211 Terri speaking, how can I help you today? I might get I don't even know where to start, Terri. And that's okay too. So what we would then say at that point is just tell us about it. And what makes our staff, what we have to offer is the training, the professional training that our staff go through in order to be able to help assess your needs. Many times people call us because they can't sit down to a computer and Google for support because they can't even articulate what the issue is. They know they've got a problem, they know they've got challenges, but they can't figure out exactly how to put their finger on what it is. And that's what we're fabulous for. So we'd ask you questions, probing questions, clarifying questions. We'd ask questions about sort of peripheral things that might be related to your issues. So for example, a person who's having trouble making ends meet, we might find out that they actually got laid off for their job. So not their primary need and question was maybe around food, but then we might also talk to them about employment search options. We might talk to them about different income supports if their current source of income, if they haven't applied for any employment insurance benefits, perhaps, or Ontario Works, whatever it might be that could be a source of income, old age security, perhaps they weren't aware of that. So when a person calls in about one thing, we often end up supporting them in a number of different ways. But back to the targeted piece, if a person calls in and presents with 4 or 5 issues, but all they want to talk about is the first one, That's perfectly okay. This is their life and their issues. So we're here to support them however they want to be supported. So we might make recommendations, we may offer additional support, but if that's not what they're looking for, then that's not what they get. The word live is there because we were a live answer. A lot of people sort of think of us and equate us with a government service. I can't stress enough how we are not a government service. We are a funded nonprofit organization. So with our live answer, it means that once you've pressed 1 for English or 2 for French, you get put through to a person. You don't have to press all kinds of buttons to get to the right department, or press 1 for food support, press 2 for housing support, press 3 for administrative. It's none of that. You choose your language and then that's it. And you get put through to a person. And so many times we have people almost in tears of appreciation saying, oh my God, it's a real person. Oh my goodness, I haven't talked to a person so long. I've been calling all these numbers and pressing buttons and leaving messages. So there's no such thing as a busy signal or an answering machine when you call 211. Another key feature, component of it is the confidential aspect of it. So when a person calls 211, we do not do any sort of case management. So if Marianne calls today, at 9 o'clock in the morning, and then Marianne calls again at 2 o'clock in the afternoon about something different. Even if I get Marianne both times, one, wouldn't know necessarily, and 2, it would be treated as a unique call. Sometimes our callers don't like that. They anticipate that whoever they spoke to last time would have taken notes and they can just continue on. It is just important to recognize, because a key feature of our service is the confidentiality. It's a one and done process. We don't keep detailed notes on a person's interaction, their name, phone number, any of that information. And a lot of people, although it can frustrate some people, the vast majority of people are very, very pleased to have the confidentiality. A lot of people will say to us that they're well connected in a community. They have a lot of supports, but this one thing they don't necessarily want to talk to their social worker about. They don't want to talk to their in-home support person. It's just private, and they'd rather talk to someone in a confidential aspect, get information on that, and leave it out of their other interactions. The next piece there is multilingual. When you dial 211, we ask you to choose 1 for English or 2 for French, but we are able to, so that gets you through to a 211 agent that can speak either English or French, but we can access a tele-interpreter on the telephone in up to 150 languages. So if a person does not speak English or French, they can call in and all they have to do is start off with their language. So if they can say Russian, if they can say Karen, if they can say Urdu, if they can say Spanish, Arabic, then we get an interpreter on the line and we'll have a 3-way conversation with them. So what that really does is help remove barriers to service for people who have difficulty accessing service in their language. So when they call 211 and we get an interpreter on the phone, they can ask the questions to the person in their native tongue, in their first language, and then we talk to the interpreter, we give the referrals back, and it's a bit of a telephone tag kind of process, but it is, and I just realized I put our faces up there, I apologize. It means that they can get the information and process it more effectively. Another thing that we often do is when a person contacts us and they're speaking to us in English, perhaps we can sense that it's being difficult for them. Maybe they have a strong accent, maybe they are struggling to find the words. We might offer an interpreter. Sometimes people get upset and say, no, I'm trying to practice my English, and that's fine. Again, everything is driven by the caller in our interactions. So we might offer things, but whatever they choose is how we're going to go. So, but other individuals who maybe have been working on their English, but when they're talking about a stressful situation, being able to interact in their first language takes one of the stresses out. It means that they don't have to do that additional processing in their minds, and it can just help relieve a little bit of the stress. So we'll offer that as well. I mentioned a couple of times that 211 is available 24 hours a day, every single day. One of our, if you notice on the bottom of the screen, it says when you don't know where to turn. That's one of our key taglines. But we have another sort of tagline that says life doesn't happen Monday to Friday, 9 to 5. And I don't know about you, but I have never personally ever had a crisis or an emergency that happened before Friday at 5 o'clock. It's always 2 o'clock in the morning. It's always on the weekends. And because of that, 211 is there for people anytime they need to access it. And if you're at all like me, I have now he just turned 19, a 19-year-old son. So I have a lot of sleepless nights now and again over different things I'm worrying about as we've gone through the different ages. And now that he's able to drink and he goes out, I'm up worrying. But regardless, there could be some situation that's got you, maybe you are available Monday to Friday, 9 to 5, but something's got you awake at 2 o'clock in the morning and you can't get rid of the thoughts. You can dial 211. You can talk about the situation. You can find out what referrals are going to work out for you. And even though they might not be open at 2 o'clock in the morning, you can go to bed knowing that you have a solution for when you get up in the morning. So I find that sort of a perk from my experience as well. And then the last key feature of 211 is the standards that we are driven by. I mentioned a little bit about our professionally trained staff. Excuse me, the people who respond to either incoming calls, chats, texts, or emails go through quite a rigorous training process. It is one of those kind of scenarios where it's your education plus on-the-job experience. So as an example, a person with a university degree has to work 1 year in the field on the job before they can apply to write the certification exam. Our training involves sort of classroom, even though it's virtual now, classroom type settings. It involves self-study. It is heavily peer driven. So people will sit with an experienced community navigator to sort of learn the ropes for them. It's very much a team approach. Many of the times a call is answered by our whole team because we reach out for support. Because another thing that's really interesting about this is people will say, well, tell me what a typical 211 call is like. And I always laugh because honest to goodness, there is no such thing as a typical call. There is an infinite amount. People are all so different in the situations that they find themselves in. There's an infinite amount of scenarios what a person might contact us for. My program coordinator has been answering phones with 211 for 13 years now. And we're training 2 new staff. And she said, wow, I just got a first today. And she'd explain what the call was, and it would be a first for her. So our staff work together to support. We are all trained in how to ask questions, how to diffuse anger or calm a person who's really agitated. We build rapport with the individuals so they're comfortable enough to share their stories with us so that we can get the information. And we have to ask questions, and that can be invasive. So we definitely want people to feel comfortable before we start asking them questions. We also we are trained on the database and how to search for the information, but really every call is unique, and we often have to sort of get ideas from other people if they run into this issue before. Have you got any ideas on this one? So the staff have to go, we have a governing body called the Alliance of Information and Referral Systems. It's a North American association. So if you think of medical, like doctors have a governing body, engineers have a governing body, we have one as well. So any agency that is providing the 211 service has to be accredited through AIRS. You go through a very lengthy process, taking the standards, which in print form are probably about this deep. And then you have to demonstrate how all of your work practices, all of your procedures, your security systems in your computers, all of these things support the standards of the system. Once you've done that, you have to keep that up to date every 5 years through an reaccreditation process. And then our staff, 1 year of on-the-job training along with the university degree, can write the exam. And then they have to keep that up to date every couple of years, every 2 years through professional development. We have ongoing training on daily almost to keep us up to date with kind of trends in the systems, as well as the tools that we utilize, which are all internet based. Any questions so far?
In the chat,
The chat?
yes, they put, what is the response time if an email is sent?
Well, with email, the emails, so the way our system, will answer that in a couple of different ways. Everything is done sort of through an electronic system. So if an email comes in, if a chat comes in, or a phone call comes in, they're all filtered into this one system and routed out to the next available agent. Because of the nature of emails, I believe our standard is that we will respond within 24 hours, but we do respond with as soon as we're able. So if there's all kinds of calls, we might take those immediate calls first and then respond to the email when there's a break. But it is almost immediate. Okay. So there's 3 different components of the 211 service. The first one is public inquiry. That's when people call us or contact us through any of those different tools that we mentioned. The second one is the online directories. So for people who prefer to self-search, who are clear on what they're looking for, people who are comfortable with the internet, they might go and search our Ontario directory, or it's important to know that the over 60,000 services that we have in Ontario, we get those from local data partners. So in our region in Central South, we are responsible for the Niagara Community Information Database, but we also partner with organizations in Hamilton for the Hamilton data. We partner with Brant for the Brant data. We partner with the different organizations in those communities. So for Hamilton, our data partner is it's actually now through the Hamilton Public Library, and I'm not sure if any of you have seen it's called the Red Book Online. So that's the database that they share that information back with Ontario 211. The reason I'm telling you that is because it's important for you to know, as I mentioned, your call might be answered in Thunder Bay, and you might think, what do they know about Hamilton in Thunder Bay? And some may know things and some may not. The important thing to know is that the data that they're using to respond to your local inquiries is coming from your community. And then the third part there is caller needs. I've sort of mentioned it a little bit, but I'll go into it a bit more. When you call 211, we'll ask you for your postal code first and foremost. That serves 2 purposes. One, it helps us narrow down our search, because again, if we're searching for services in all of Ontario, your postal code will help us give you referrals that are closest to you rather than something from Algoma District up north, for example. So postal code helps us identify resources that are closest to you, but it also lets us capture where people are calling from. If a person doesn't want to give their postal code or doesn't know it, for example, or just moved, whatever it might be, we just ask what city you're calling from. And that way we can identify where you're calling from and what services are closest to you. We also ask questions that we need to in order to find referrals for you. We don't ask information just for the sake of keeping statistics. That is a double-edged sword, because people who are looking possibly to fund us say, but we want to know how many of your callers are Hispanic women that are single moms, for example. And we don't keep that level of data. But the plus side to it is for our callers, again, it goes back to that anonymous and the confidentiality. We only ask information that we need to in order to get the appropriate referrals. So for example, I'm not going to ask your age on a call, but I might say, okay, I'm doing a bunch of, Christine, I'm looking here and I'm finding a number of resources in your area, but some of them are for people 55 and older. Would you fit into that category? Christine might say yes or no, or she might say, oh my goodness, I'm 35. And then I know exactly how old Christine is. So what we do is we track sort of the age ranges, but again, only if we need to know for the referrals or for the type of service that we're giving. Source of income is something that we don't always need to get, but it can be relevant in a lot of different programming and services to help us figure out what a person's situation is. So any of the calls that you're asked when you call 211 are going to be relevant for us trying to determine the best referrals for you. And any information that we capture, we will keep track of. So we provide reports at the end of the year called caller needs reports. So we can identify how many people called from what area and what were the reasons they were calling. So it might be for housing, it might be for shelters, which is the same thing. It might be housing, it might be food, it might be medical support, it might be how do I find a new doctor? It might be that I'm having difficulty. I'm in my own home, it's paid for. I don't want to move, but I'm having a little bit of difficulty moving around. Is there any support? So we could give you referrals for people that could come in and do an assessment in your home and suggest different aids that might make things easier. So whatever the reason a person calls, we track that and we can report back out to the community on that. Many times when a person calls, one call can result in 2 or 3 or 4 or more needs. So we track all of those. The other thing we track is unmet needs, and that can be even more important to many communities because when there is a trend showing of people calling for a specific situation or need, but there is no program or service to support it, then local organizations can look at that information and perhaps put together a program that might meet that need. And they can use our statistics to support a funding application, for example. So we can inform communities on what the people who call 211 have identified as needs that are not being met in their community. So just as an example, so far till the end of July of 2021 this year, there have been 3,724 different contacts answered from the Hamilton area. The statistics that we have of the people who did contact us, 51% of those were female, 33% were male, and 16.3 were unknown. And that's because if it's not relevant to the referral of the information, if you're calling to ask when the library opens, we don't need to know your gender, for example, so we wouldn't track it. And then just the age ranges that we have. So 56, the majority of our callers are aged 25 to 59. That is a large group. 20% are older adults that are 60 years of age and older. And this is sort of a visual display of from January to the end of July this year, what the top reasons people have been calling us. So the first one is health. That kind of makes sense. Health is always in the top 5. No, as for the 11 years I've been doing this, health is always in the top 5 for all of our regions. It's one of the main reasons people call 211 to get information that's health related. But certainly during COVID, it's been the number 1. The second highest one is housing related. And then they get closer there. We have information services, which might seem weird to you because that's what we are. But if we refer to a specialized information service, then 211 is a general. We know a little bit about a lot. And then we talked about 311 earlier. 311 is only available in 6, maybe 7 now, cities in all of Ontario, Halton being one of them. And that means that 311 is sort of a smaller group, and it's services that are provided by that city or region. So in Halton area, as an example, they have 311, and you would call them for any programs. There's information on any programs and services that are offered by the region of Halton. Okay, like garbage pickup and that kind of thing, parking, that sort of thing. So 211 is the larger area, and it covers all of Ontario. 311 is just some specific areas in Ontario. But if a person called and the referral to them was 311, it would be counted as an information service referral. Legal and public safety would be things like family law questions. It would also be landlord-tenant issues. And one of the reasons it's so high is because it goes with the housing kind of crisis type of things. And the last thing I'll just explain to you is 211's role in emergency response and recovery. Because it's mandated through AIRS that we have disaster plans and be able to support our communities in times of emergency. But for a number of years, we weren't really sure. We knew we had a role, but it was very hard for us to articulate what it might be. And it was certainly harder for some of the government emergency services to understand how we could help them. So we came up with this visual that really made it simple. So if you think about it, let's say that there's some sort of, we're not going to go with a global pandemic. We'll go with something smaller. Let's say there is a block in downtown Hamilton that is on, there's a fire and there's evacuations happening and there's some concerns about toxic fumes and things like that. You know, should people, so we have the situation going on, and then all of the emergency responders are meant to be, and they need to focus on solving that problem. But over here, we have all the people who want to know what the heck's going on. And before 211 or without using 211, a lot of those people dial 911 to try and find out what's happening. What's happening over there? What's going on? Are we supposed to stay inside? Are we supposed to evacuate? What are we supposed to do? And what that means is by calling 911, we're taking resources away from dealing with the emergency. So what 211 can do is wherever emergency there is someone coordinating that emergency. So there's always a lead person. It's usually often the fire chief in a community who is, excuse me, the emergency management coordinator. They have all of the information about the situation, what people should be doing, and how they're managing it. So what we've said is we reach out to the coordinator and say, give us the information that you want the public to know, and then tell people not to call 911, but to call 211 for that specific information. When they call us, we just give out the approved information so that the general public gets the information they need, and the 911 and the emergency responders can stay doing what they need to do. It's really interesting. We've supported so many communities in times of emergency. And again, every single emergency in every single community seems to be different, what they might need our support for. So some examples that we've supported communities before is sometimes they're looking for volunteers and they want us to be the volunteer registry. So people call 211 and register to volunteer. They give us the forms, they give us the criteria. All we do is capture that information and get it back to them. Other times they're asking people to call 211 to find out about road closures, to find out about whether they're supposed to, the word's just escaping me, shelter in place, or whether, are the schools going to be opened again? Can they get their children? How are they supposed to get their children? All those kinds of things. So this is a way that 211 can support the community in times of local emergencies. But if we look at the actual global pandemic, 211 has gotten a lot more press in the last couple of years. Both the Prime Minister and the Premier have tweeted and spoken and gone on record as saying, please call 211 in your community to find out more information about vaccines, or how to get rides to your vaccination appointments, or what you should be doing in this, finding out about the CERB income support and things like that. So again, it's an example of where the person with the information provides the information to us so that we have the trusted source, we can be the trusted source for information. And then they instruct the general public to give us a call so that we can provide that information and answer their questions. So that's it for me just talking now. Does anybody have any other questions?
I do.
Yes.
On the pie chart that you had there that showed the distribution, that one, thank you. So I'm kind of interested, like, because I work at the Alzheimer's Society, how many people call asking about, I have a neighbor I'm worried about, like, is this, I'm actually going to be doing a presentation is on this. I have a neighbor that I'm worried about. Is 211 what I should be telling people?
Absolutely. Absolutely. Okay. So people, again, it's 24 hours a day. People can call for information for themselves or for other people. The only challenge we get into sometimes is assessing the person's needs when it's a neighbor trying to tell us about their neighbor, right? But in general terms, yeah, we're without specifics, we're always able to direct them at least to the closest and the best service provider to start the conversation.
Okay. And the Alzheimer's Society, we should make sure that the Red Book is updated because that's where you guys look.
Exactly. Yeah.
Okay.
So all of the organizations, so within the 211 system, any data support supplier to us, we are mandated within our standards to verify the information on the database a minimum of once a year. with that agency. So it is also important to know that we're not just saying, oh, no, that looks good still. I'm sure nothing's changed. We have to reach out to that organization and verify that the information in the database is up to date and accurate. And if anything new needs to be added. So when you're on the records in the Red Book, you can see usually within the actual database record when it was last fully updated, or whether it was just modified recently. So you can tell how recent the information is. But yes, any organizations, when the Red Book reaches out to say, can you do that? And you think, that's the least of my worries. Just remember that that's the information that we utilize at 211, and you have no idea how many people might be calling to access that information.
Perfect. Thank you.
No problem.
Hi, Terry.
Hi.
Yesterday, I belong to a Facebook group. I live in Westdale, and there's a Facebook group called Westdale Neighborhood, and people post sometimes questions. Does anybody have a recommendation for a good contractor or some such thing? So yesterday, someone asked on behalf of an elderly neighbor for someone who could do light cleaning services for that person. Is that something that 211 could help with?
I'm so glad you asked that, Geraldine, because I realized I didn't clarify with you deeply on what kind of information is in our database. So what we keep in our database is basically any service that is free to the general public. So it's funded by someone. So it's a government service or a nonprofit program or service. We keep all of that in our database. We at times will keep a for-profit organization in our database, but our inclusion policy says it's only if that need is not being met by a free service.
So I think I got the impression from the question yesterday from the posting that she was actually looking for, is there some kind of a government or public service that for the elderly that would provide this kind of help?
Perfect. Yes. So if we don't have it in our database, we would still problem solve with the individual on how to locate it. So 211 is a great referral for something like that, because what we would do is ask a number of questions to find out if they might qualify for a free or a subsidized type of a low cost service. If they don't, then we would let them know that and just help them figure out how they would locate a for-profit business. And that would just be, going in the yellow pages and things like that. But we do not recommend, actually, that's another important thing. We never recommend anything. So one of the things that we have to do, again, through our standards is when we search in our database for something and there are 6 different referrals, we tell you there's 6 different referrals and we give them all to you. If you say, well, which one would you contact? We are absolutely forbidden to recommend. Okay. We must be an impartial service in our database. If we have a pro-life service, then we have to have a pro-choice service as well. So it has to be fair and unbiased. And when we give referrals out, it's always presented that way as well. So we would never give advice. But what we can do is provide information. So we can direct people on how they could find information if it's not something. So if we identify a program or service, but they're not eligible for it for whatever reason, then we would give them information on how they could locate another option. So that's why 211 is a really great place to start, because you'll find out about anything that you might qualify for that's free. We just don't keep things like restaurants or shopping malls. We don't keep that kind of stuff in our, well, we've had people, it was funny because we had a person calling once for, I think it was Swiss Chalet. And we said, oh, I'm sorry, that's not the kind of information we keep. We talked about, we do keep information on health related. And she goes, oh, well, I'm diabetic. So if I don't get food soon, it could be a health issue. So can you get me the phone number? So we said, sure, why not? But that's, again, us going on an internet search to support.
Right.
And I don't want to let go of what you were talking about earlier, Geraldine, about if anyone, so on 211 Ontario, or by just calling 211, if anyone is interested in promoting it in 211 in their doctor's office, in their workplace, they might have a meeting that they attend and they want to share the information, you can contact 211 and we can send you out resources. You can either go on the website to just pick out which ones you want, or just call 211, and then we will mail those out to people to distribute. So if anyone is interested, or maybe the next time you're talking to your doctor and say, have you heard of 211? Because many of them have not. Then I could bring the information out. Whenever I go to my dentist, I bring a new handful so that they can put them in the office for people.
I definitely want to do that. Absolutely. I came to Hamilton 15 years ago. I'm an American, and there are a lot of things available here that would not be available in the US. And over the years that I've been here, I can think of a number of times that I could have used 211, and I had no idea that this sort of thing existed for health, for when I became a senior, for government services, etc. So I will definitely get a bunch of flyers. I can think just offhand of at least 2 or 3 places where I would like to leave them.
That would be perfect. That would be wonderful. And I had a thought and I lost it there. Oh, at the beginning of the call, I asked how many people had ever dialed 211, and not a single one of you had. So one of the things I do in every one of my presentations, but especially today, I'm going to ask of you to either the rest of today or into tomorrow, if you kind of find yourself, if somebody asks you a question and you think, oh, I'm going to look that up, or you might know the answer, but you also think, I wonder if that's a 211 thing. I'm going to ask you today or tomorrow to call 211 and ask your question, find out the information. Because as I mentioned earlier, this might sound really wonderful and fabulous today, but you know what? In 2 days, you get, focused on family, you get focused on whatever it might be that you're doing, and it kind of slips out of your mind. But if you call 211 and go through the process to experience what it's like, then you're more likely to utilize it again in the future, or even share that information with a friend or family member.
Great suggestion.
Terry, I actually have called 211 in the past.
Okay. Excellent.
One of the things that I found really helpful, I was a health professional. I'm retired now, but a visiting nurse. And we had someone from 911 come in to speak to us. This is probably about 7 or 8 years ago. And one of the things she left with us was fridge magnets. So I took them out to my patients, and once it's on the fridge, people always see it and wonder what it is. But that was one way to promote, and I found it very helpful, especially giving them out to doctors or agencies, and they take them out to their patients. So
and we actually do have magnets as well for that reason, and particularly seniors like magnets. It seems, and when I try to give magnets out to like 20 somethings, they look at me kind of funny for some reason. But yeah, we do have magnets as well for exactly that purpose.
I still have mine on my fridge.
Wonderful.
Terry, I would like to have the information to have it here in the agency, to like a flyers or something about the 211.
Okay, so I'm going to ask you to call 211 and ask for those flyers. And then again, sorry, it's not that I won't send them to you, Mildred. It's just, I would love you to experience the call of 211. So just say, I work with an agency and I'd like to get some 211 materials, and then they'll go through the process of getting those through to you.
Oh, okay. Thank you.
If you don't have time, just let me know and I'll send them to you. But,
okay. Well,
if there's no other questions, then just keep in mind, 211, we're here to support you in the community. Our whole purpose is we have all of the programs and services that are there ready and able to help people on one hand, and we have the people who need it and they don't always connect. If people know how to connect what they need, they don't need 2-on-1. 2-on-1 is for the people who aren't sure, aren't aware, and need a little bit of support. I would also say that 90% of us could find, or 90% of the population can probably get the information they need on their own most of the time, 90% of the time. But every single one of us, once in a while, needs someone to talk it through so they can even figure out what the problem really is and what possible solutions there might be. So that's what we're here for.
Thank you so much.
Very
My
helpful.
pleasure.
That was very helpful. Yeah.
Excellent. And it's recorded for anyone who wants to have it afterwards as well.
Yes. And I will, let me stop the recording.